3 people are dead, dozens are sick, and passengers from a virus-stricken Antarctic cruise ship have already scattered across the globe, potentially carrying hantavirus with them, before authorities even understood the full scale of what they were dealing with. The MV Hondius has now docked in the Canary Islands. Germany, France, Belgium, Ireland, and the Netherlands have all scrambled evacuation flights, and contact tracing is now underway internationally. And yet, here's what nobody wants to say out loud. We've known about hantavirus for decades. It kills between 35 and 50% of those who develop severe symptoms, and there is still no approved vaccine or treatment anywhere in the world. Joining me now are Alex Park, our technology and science analyst, and Marcus Webb, our defense and security analyst. Alex, let me start with you. Is this a genuine systemic failure, or is this just the unavoidable chaos of a novel outbreak in a difficult environment?
Thanks, Emma. Look, let's be very clear about what we're actually looking at here. This is not a novel outbreak. Hantavirus is not some mysterious disease X that emerged from a jungle last Tuesday. It's been killing people in South America for decades. Argentina is consistently ranked by the WHO as having the highest incidence of hantavirus in the entire region. We've had time, we've had the science, we've had the resources, particularly after COVID-19, when the entire world agreed that pandemic preparedness was the defining challenge of our era. And yet somehow, in 2026, a Dutch tourist visits a rat-infested landfill in Ushuaia, boards a cruise ship, and there is not a single approved vaccine, not a single licensed antiviral treatment that doctors can reach for. Douglas Murray talks about the West's habit of outsourcing its thinking to supranational bodies and then acting surprised when they fail. Well, here it is in real time. The WHO, the CDC, the European health agencies, they had decades to prioritize this. They didn't, because the people dying were mostly rural South Americans, not Europeans. And now Europeans are dying, and suddenly there are evacuation planes in the air. That tells you everything about how global health priority setting actually works.
But, Alex, devil's advocate here, isn't this exactly what international cooperation is supposed to look like? Spain authorized the docking, the WHO signed off, European nations coordinated evacuations. Isn't that the system working, even if imperfectly? And Marcus, what's your take on this?
Well, look, I want to give credit where it's due. The evacuation logistics are genuinely impressive. Getting Germany, France, Belgium, Ireland, and the Netherlands to coordinate simultaneous flights in a matter of days is not nothing. But here's what I think Alex is missing. The real scandal isn't the response. It's the intelligence failure that preceded it. Multiple passengers returned to the United States and other countries before authorities had even characterized the full outbreak. That's not a cooperation problem. That's a biosecurity screening failure at the most basic level. We spend enormous amounts of money on port security, on customs infrastructure, on international health monitoring systems, and a ship carrying a hemorrhagic fever pathogen with a 35 to 50% fatality rate in severe cases somehow disgorges its passengers across the Western world before the alarm is properly raised. The contact tracing operation now underway internationally is reactive. It should never have been necessary. And the dock workers in Santa Cruz who staged protests when the ship's docking location was announced? Those people had legitimate concerns, and they were overridden by a bureaucratic agreement with the WHO before the transmission picture was fully clear.
I hear what Marcus is saying about biosecurity screening, but with respect, that misses the point entirely about where the deeper failure lies. Yes, the screening failed, but why did it fail? Because nobody built adequate surveillance protocols for hantavirus in the first place. You can't screen effectively for a threat you haven't adequately characterized and resourced. The Breitbart reporting on Patient Zero is instructive here. A man from a Dutch village visits a rat-infested landfill at the southern tip of Argentina. That's a known high-risk vector. Argentina is a known hantavirus hotspot, and yet there was no protocol, no alert system, no early warning that caught this. This is what happens when you build a global health architecture around political optics rather than scientific risk assessment. Ben Shapiro has made this argument relentlessly. The health bureaucracy can't prioritize because it's structurally political, and it costs lives. 3 so far. We don't know yet how many more.
Here's what I want to know. We're now looking at passengers scattered across Europe and North America, an incubation period of potentially up to 5 weeks, and no approved treatment. Marcus, where do you see this going? What's the realistic trajectory here?
The way I see this playing out, there are really two scenarios that matter. The optimistic one is that the contact tracing works. Hantavirus doesn't spread person to person the way respiratory viruses do, which actually limits the secondary transmission risk significantly, and this is contained without additional clusters emerging. But the concerning scenario, and the one authorities aren't being fully transparent about, is that we won't know for another 3 to 4 weeks whether any of the passengers who flew home before the outbreak was characterized have already seeded new exposure events. Hantavirus pulmonary syndrome can look like a bad flu in early stages. The risk is that GPs in Rotterdam or Pittsburgh or Dublin see a sick patient, don't think to ask about a cruise ship in the South Atlantic, and the chain extends before anyone connects the dots. That window, the next 30 days, is genuinely dangerous.
Here's what concerns me most, and this is the scenario that should keep health ministers awake at night. The WHO and the global health establishment are going to declare victory the moment the last evacuation plane lands and the case count stops rising. They will hold a press conference about unprecedented international cooperation. They will produce a report, and then absolutely nothing structural will change. The Telegraph asked directly why there is no hantavirus vaccine, and essentially got an answer that amounts to, it wasn't profitable enough, and the political urgency wasn't there. If this outbreak, 3 dead Europeans, multinational evacuations, international contact tracing, isn't enough to finally move the needle on hantavirus countermeasure development, then I genuinely don't know what will be. And the next outbreak won't politely start on a ship. It'll start somewhere, we can't contain it.
Dark assessment from both of you, and frankly a difficult one to argue with given the track record. Alex Park, Marcus Webb, thank you both. One thing seems certain tonight. There are a lot of bureaucrats in Geneva and Brussels hoping this story stays contained to the Canary Islands, because if it doesn't, the questions they'll face won't be ones they can answer with a press release.